So last week, the American Society of Anesthesiology has put out recommendations for patients who are on GLP-1 agonists. GLP-1 agonists are the medications Ozempic, Wegovy, Mounjaro, Saxenda. There's several other ones out there too. And these medications are very effective for both diabetes control and weight loss. And there's lots of people on them, as I'm sure all of you know. Now, one of the problems we're seeing in the world of surgery is that patients on these medications are having higher rates of aspiration. So when they're being placed under anesthesia and a breathing tube is being placed, that acid and the contents of their stomach are coming up and can cause life-threatening pneumonias. And this is something that's really worrisome, and we've been talking about it a lot in the surgery community over the last several months. So I'm excited to see that we're actually addressing this with some formal recommendations. So if you're on these medications that are injected on a weekly basis, you need to stop these medicines for at least a week prior to your surgery to prevent aspiration. If you're on these medications in daily dosing, you need to stop them at least the day of. Now, they also tell you to consider the symptoms the patient's having. If you're having no symptoms, meaning you're not having nausea and vomiting or abdominal discomfort, you can move forward with your surgery. But if you're having an elective procedure, you're on these medications, and our patients are complaining of nausea, vomiting, abdominal pain, you really need to consider whether or not the surgery should be done. If it's elective, it's not an emergency, and you really worry that people with these symptoms are at higher risk for aspiration, and these surgeries should probably be canceled. They also note that if your patient has not stopped the medications like we've recommended and they don't have symptoms, it is reasonable to proceed, but you need to treat them as though they are an emergency case and they come in with a full stomach. The last thing they mention is we don't really know the optimal time to fast prior to surgery to prevent aspiration from stuff being in your stomach. So we typically request that patients don't eat anything for 8 hours before surgery, and you can have clear liquids up to 2 hours before surgery. But the suspicion is that when your stomach empties slower, you might need more time if you're on these medications. So it's definitely something to discuss with your doctor. Currently, the ASA is recommending the normal fasting times, but it's definitely something you should talk to your doctor about. They may want you to fast for longer. And finally, there are so many people on these medications getting them from clinics online, over state lines, and their doctors may not even know they're on them. So if you're a patient having any type of procedure, it is so important that your team knows if you're on these medications. Don't be embarrassed. Don't be ashamed. We're not there to judge you. We want to keep you safe. So make sure your team knows you're on these medications so they can take the proper precautions to keep you safe.